response and in the fight against this pandemic, the role of political leaders is central. The role of business leaders is very, very important and central too. And the role of religious leaders and community leaders is very, very important. And we're reaching out to government leaders, political leaders, business leaders, religious leaders, and community leaders, and other influencers. It's through those leaders that we can reach out to all communities to take part in the fight. Then having said this, with regard to Ramadan, as you have been following, countries in the Middle East have been doing everything they can to limit the spread of the virus. And we will continue to engage them. And I know that we will have an amicable solution on this one too. We're very close and closely working, and our cooperation so far is very, very successful, and we hope that we'll continue in that spirit. By the way, not only something they're doing for their own region, we're getting a lot of financial support from the Middle East and from the Arab League members. And I would like to use this opportunity actually to thank them, not only for taking serious measures in their respective countries, but for their solidarity to support countries who need support. And the recent pledge, as you remember, is from Saudi Arabia, which I have said a few days ago, and yesterday from Kuwait, big financial support. And we will keep in touch, we will work with them closely, and I know they will continue to protect their own people, but at the same time support countries and communities who need their support.
Thank you very much, Dr. Tedros. We go to Guatemala now, to Grecia Ortiz, Diario de la Hora. Can you please ask your question?
Thank you so much. Can you hear me?
Yes, please.
Thank you. How do you see the situation for COVID-19 in Central America, and what are your recommendations for the governments?
Thank you very much, Garcia.
I think there's the countries of Central America are sort of at the beginning or the upcycle of the epidemic. There are different capacities in different countries and different risks and different threats. There are lots of vulnerable people, migrants and others who are scattered throughout the sub-region, and there are many other communities who may be left behind as well. So Central America is dealing with the challenge, its own challenges. Certainly the small island nations of the Caribbean equally have different challenges. So each country has a different combination of economic challenge, social challenge, its vulnerable populations, its public health system, its healthcare system, and how all this is put together. And it's really important that each country, and I am glad to report that almost every country in Central and South America now has a national action plan that is being supported by the international community, in many cases by humanitarian partners in the UN system and NGO partners. And some countries do need that external assistance. It's also important that countries in the Americas and Central America and the Caribbean, in South America, are coordinating amongst each other to align their strategies and to align their policies, so we don't see massive differentials in action and pushing people from one side to the other. We have people moving throughout the Americas, and we need to be sensitive to those who have least, and we need to be sensitive to those who are most vulnerable. But it is important that Central America, like all sub-regions, scales up its public health response, scales up its community engagement, scales up its healthcare preparedness, and has, as the Director General has said so many times, an all-of-government approach to this. This is serious. This is a deadly virus. People will get through it, countries will get through it, but we must build the architecture of public health, the architecture of our health system, if we're going to get out of an interminable cycle of economically punishing lockdowns and shutdowns. We must get back to be able to control this virus, live with this virus, develop the vaccines that we need to finally eradicate this virus. So, as I said, the message to Central America is very similar to that to the rest of the world.
If I could just add, so we have, within our guidance materials, what we've done is we've, in addition to putting out general guidance around infection prevention and control and clinical management, we've put out a series of guidance documents relating to the 4 Cs, these no cases, clusters of cases, community transmission, so that there's specific actions associated with what needs to be done with whatever transmission scenario you're in, but also to prepare for other scenarios that you could eventually be in, and get your systems ready, and just activate those systems now. We've seen how this virus behaves in a number of countries, and we need to prepare for that may happen in your country. So there's some practical guidance that we have on our website related to clinical operations and getting your hospitals ready, finding locations where you can treat mild patients versus severe patients, readying your workforce so that you can have people who can identify cases and help with case finding and contact tracing, to help find where you can where you can quarantine your contacts. So there's some practical information that's online that's there to help you tailor that approach and what Mike said around this comprehensive measures to get yourselves ready and activate those systems now.
Thank you very much. We will try now to connect to Mr. Bujar Vitya from Gazeta Šnet, that's Kosovo-based outlet. Mr. Bujar, can you hear us?
Can you?
Yes, please go ahead.
Thank you. From February 1st until today, over 20,000 people have entered Kosovo from abroad, Italy, Germany, and Switzerland. The first case was confirmed on March 9. We are now in the 4th week of the epidemic with 112 cases. In 1,300 people have been tested. What is the best recommendation for Kosovo considering these numbers? Do you recommend that? Thanks so much.
Okay. Kosovo is a country that has obviously emerged from very difficult time. Has had to rebuild its health service, and tefala to everybody in Kosovo. I spent many months in Kosovo helping to stabilise the health system in the aftermath of the great difficulties there. And I know deeply the vulnerabilities and the challenges the health system in Kosovo and the people of Kosovo have faced over the years. And the health system in Kosovo is still vulnerable. It has many excellent professionals within it. It's a hugely committed workforce. But we do need to ensure that we have in place good surveillance. Kosovo has had and built an early warning system that's syndromic. It needs to build on that. Kosovo needs to have an active system of detecting cases. We need to have the testing in place, and we need to invest in building the community's response and having community-based surveillance and strengthening the healthcare system so that you can deal with infected cases. Albania and Kosovo are only across the water from Italy. You are very, very close to some of the most intense epidemics in the world right now, and it is really important that health systems in the Balkans in general, but in Kosovo specifically, need to be rapidly strengthened and be able to cope with this disease as it may accelerate. So again, with my warmest greetings to all my friends in Kosovo.
very much. We have more questions from the Balkans. We may come back to them later. Let's go now to India. Do we have someone from India today? And that's
Hi, my name is Ankit Kumar. I represent India today.
Yes, Ankit, please go ahead.
My question is the World Health Organization been tracking the developments in India? How will you comment on the progress made by India in the first week of lockdown, and how do you assess the results so far? Thank you.
I think it's a little early to assess the results of the lockdown, but I think we need to step back and assess the results of the response in general. Lockdowns and shutdowns are really should just be part of an overall comprehensive strategy. And what we need to be able to do as societies and with the leadership of an all-of-government approach is to be able to implement a consistent policy for a period of time and then see where that takes us and then measure and see what we need to do next. We need to be very careful not to knee-jerk. We need to be very careful not to be changing policies every single day because people on the front line need certainty in their days. Communities need some certainty. So it's really important that we are very consistent in our communication with communities and our frontline workers about what we do. And we need to give clear messages about what we do for the next week or the next 2 weeks. And we need to then be clear when we're going to evaluate the impact of that period of intervention. And then if we have to change, we change, and we communicate that clearly. And then we do it again for another 2 or 3 weeks. And then we see how that works. And then we gather the information, and we consult with our frontline workers. And then if we have to adjust or change. This is about adapt, adjust, implement, measure. Do it again. And you just have to keep doing that over and over and over again until you control the disease. I would love to say that there's an easy way to do this. I would love to say that there's a way out of this without that kind of hard work, but there isn't. We have to be comprehensive. We have to measure everything we do. We have to measure at below the national level. And then, if we have to use lockdown, if we have to use shutdowns, we do them as part of an overall comprehensive strategy. I would say India, and as the Director General has said in his speech, has made a really huge attempt to limit the impact of the shutdowns on the people who are most at risk and people who are most vulnerable in India, and that's a great thing to see. We see increase in testing. We're seeing an increase in surveillance, and we're seeing an investment in the healthcare system to be able to deal with more cases. But it is certainly too early for anyone to determine the impact of the shutdown or lockdown measures on disease transmission at this point.
Thank you, Mike. I mean, the health issues are very important, as Mike said. I would like to add the other side. As you know, this is the first ever coronavirus pandemic in the world, meaning there are many unknowns. And whether we do shutdowns or take other measures, we have to understand that we're in a learning process. We have to constantly learn from our actions and adjust based on what we learn. But I would like to again underline, this is the first ever coronavirus pandemic and its behavior is still unknown. And that's why we should always be in a learning mode. The other part is not only the public health measures during shutdown, but it should be the social and economic factors that we should consider. And what India is doing, as I said in my statement, is very, very important. During shutdowns, there will be economic consequences on the country at large, but more importantly, individuals who live on daily subsistence, who give their labor for their daily bread, could be affected the most. And that's why India is taking measures